Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com.
Aloha Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and Medical Director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Okay, I'm sure many of you in your life have heard, you ought to write a book. Every now and again we get a chance to talk to a patient of the Vein Clinics of Hawaii, and she actually did that. So, we got to watch our P's and Q's and dot our I's and cross our T's. We're going to have a patient in just a minute. But, Doc, I think it's kind of interesting, particularly right now, that when we are able to break the mold, we talk about some really neat stuff on this program, everywhere from, cosmetic fixing of little tiny spider veins to really life-saving techniques that you use at Vein Clinic to fix people's errors. So isn't it every now and again a real grateful moment that we have when we can actually talk with a patient about their experience, not ours? Because usually it's me, because I'm a patient too. But
Right, yeah, and I think for our listeners to be able to hear the story of another real life patient,
Sure.
I mean, it really kind of brings it home. We talk theoretically a lot on this show and talk about specific problems, etc. But I think when we talk with somebody who has real symptoms and how they have evolved and how it impacted their life and their quality of life, etc., it makes it so much easier for other people to identify, because like we've talked about, sometimes it's hard to connect some of the symptoms that people have with venous insufficiency with a vein problem.
yeah, and I'm always amazed and nicely amazed at the way that people actually find out about the practice and then become somebody that goes to the practice. And that's what we have here, somebody that I guess was just casually watching television one day on the Big Island and saw this guy named Dr. Juliff and decided, hey, wait a minute.
Yeah.
We like to give our patients a name, our guests a name, so we'll call our guest Noreen, because that's her name. We didn't have to make it up. Hi, Noreen.
Hello.
First of all, thank you very much for sharing with us. I think that when we talk on this program, like I said a few seconds ago, we talk about some pretty heavy stuff. And did you think that you were in trouble? I mean, let's talk about what was the needle that moved. What sort of symptoms that you had to maybe make you think, hey, they're talking about me on this TV set?
I had such horrible pain. I needed some help.
Mm-hmm.
And so I thought, well, I'll look into this. I did not know if I had venous insufficiency. I didn't know what it was. All I knew was that my legs did not work the way I needed them to work. They were causing me pain, not only at night sleeping and waking me up, but during the day. They would feel heavy. It was hard to go up the stairs. I wondered at one point, is it because I need to lose weight? Is it because I'm overtired? Why is this? And so I was desperate, and Dr. Juliff helped me.
That's pretty much the checklist, Doc.
Right, right. And that's a perfect example of what we're talking about, because, the symptoms of venous insufficiency, they come on so slowly and over such a long period of time that it's, for a good period of time, it's easy for the patient to kind of ignore those symptoms and just kind of keep plugging along with life, making little alterations here and there. But Noreen, I think, obviously her symptoms got to a point which she was no longer able to ignore them. And how long ago do you think you reached that point? The symptoms don't come on, boom, overnight like that. They take a while. So how long were you...
Yeah,
how long were you noticing your
symptoms?
symptoms, and you, like you said, you didn't necessarily, or you didn't at first connect it with vein issues, which nobody, hardly anybody does. I mean, unless they are somehow involved in, the medical world. But How long were you having symptoms before you really started to feel like you needed to do something about it?
I was having symptoms at least 4 or 5 years before, and I
Yeah.
was using natural homeopathic things like arnica gel and essential oils and things like that, but they just didn't cut it. I also was using the heat packs you can stick on and soaking my legs, anything to try. And so I'm so thankful for you.
Elevation?
Oh, yeah, all the time. Still
I
do,
used to have
yeah.
to think that my legs are up in the air 24 hours a day.
Yeah, and, you know, elevation is a good way to treat the problem because it definitely makes your legs feel better, and it's something that I think most patients just kind of stumble on themselves. You know, they feel like, gee, it feels so good when I put my legs up, so I'm going to put my legs up. So you know, at the end of the day, especially, they go home, they find out that, gee, I can lay on the couch and get my legs up on 2 or 3 pillows, and all of those symptoms, you know, start to subside at least. Maybe don't go away completely.
Well, for some of us, even that doesn't help enough. And after a while, you have your legs up enough, and the fluid will start to hang off the back of the hassock or whatever you have your legs on.
Yeah.
And it just doesn't help enough. I feel you have given me hope by helping me, and other people can get that hope by having this work done. It's such a life changer. It's wonderful. I can't say enough good about it.
Yeah, see, that's the part that we hear a lot. And by the way, you can see folks like Noreen and me and others by going to the website and just taking a look at some of the things before and after and what some of these things are. But I think, Doc, what I like learning already about Noreen is that she immediately wanted to get, there was a point, and I want to find what that point was.
Yeah.
What was the straw that broke the camel's back? It's that's dumb. I'm not going to do this anymore. I'm going to get some help.
Right. There is a point at which, you know, the symptoms are going on so long, and the the remedies, the daily remedies that people do are not taking care of it adequately. Like you said, there came a point at which, gee, you would elevate your legs, but even that didn't impact the swelling all that much. But getting back to sort of the beginning, did your mother or your father, anybody in your family, have vein issues that you know of, or did they have similar kind of complaints, but they never really found out that it was due to vein issues?
The second one, my mother constantly had problems with her legs, and just never had it sought out to find out the answer. But until she took her last breath, she still had problems with her legs.
Well, what kind of problems was she having?
Oh, she had the same. She had the swelling, soreness, burning, picking, and achiness. And she had been very active throughout her life with hunting, fishing, walking, things like that. So it was making a big impact on her life. I think that if she would have checked into this with her other health problems that she had, she could have found a great relief from having this work done.
Right, yeah. I mean, we hear that all the time. And you know, that kind of brings out another point, and that is that, you don't have to have varicose veins to have, pretty substantial vein functional problems that are causing major symptoms. And that's one of the hurdles we, have to get over often because, most people know that, gee, I have varicose veins, I must have a vein problem. But like yourself, you didn't have that as a director. You didn't have that issue to help you get to the point to be able to say, yeah, you know what, I have a vein problem, I need to go see a vein doctor.
That's true. I had gone to another provider, and they had given me dozens and dozens and dozens of injections to help with spider veins, but it didn't help with the pain. It didn't take care of the problem that you found that I had and needed treated.
I think that's where I like to know something, and that is because we talk about the cosmetic side of venous conditions, which are the spider veins, and then the health side of it. So what you had treated was the appearance part of it?
Yes, and I was told that it would help. And they actually did ultrasound on my legs and didn't find anything that I needed fixed. So when I went back to Dr.
They weren't
Juleff,
using the right ultrasound, Doc, were they?
when I went back to Dr. Juleff, he said, "Oh, now this is even worse." I thought, yeah, I'm trusting him, and that was the best choice I could have made ever.
Yeah, well, that goes to the issue of, like you mentioned, Mike, there are strictly cosmetic problems, with veins certainly, and then there are medical problems, and sometimes we don't really know. Now, sometimes spider veins happen just sporadically. A patient may not have any venous insufficiency; they just have spider veins. That happens. But on the other hand, it happens conversely too. Sometimes spider veins superficially are the only things that might be leading us in the direction of it being a vein problem. So that's why a lot of people will come in or call the office and say, "Gee, I've got spider veins. I want to come in and get them injected." All of those people, typically we like to talk to, for sure. But most of those people, we end up recommending that we do an ultrasound just to make sure that or to answer that question. Do they or do they not have underlying venous insufficiency? And do they have symptoms that might be related to that and hopefully may benefit from treating the medical part of the picture as well as the cosmetic part?
Were there any surprises when the diagnosis was made, Noreen, that you said, "Boy, I thought I had this. I'm glad to know now that I do"? How relieving was it to get it, diagnosed the way it must have, so that you could have a treatment plan?
It was a great relief, and also to know that there was help and hope. And then having it done, and I found out I needed more work done than I had when I'd seen him before. It's just life-changing.
When she says she's had it done, Doc, for those that don't know what that is, what is that?
Well, we did. I believe Noreen had 2 veins in each leg. 2 of the main veins, we call those axial veins, and they were refluxing. Blood was going in the wrong direction, and that typically is the reason why that leads to pooling of blood in the lower leg and the symptoms, et cetera, et cetera. So one of the very common procedures that we do is something called endovenous ablation. And that means that we basically close down that vein. Now, why do we close that vein down? Well, we close it down because it's not repairable, at least with the technology that we have today. The blood flow starts to go in the wrong direction. That happens because tiny little one-way valves in the veins are failing. And those valves are very, very small. They're just little wisps of tissue, and when they're intact, they function. They do their job well. But when they're not, they don't. And we don't really have the surgical methods to repair those tiny little valves. So we close the vein down. Now, in the past, in the remote past, we used to do something called vein stripping.
Booyah.
And most people are familiar with that, and that achieved the same thing. When we did vein stripping, that vein was no longer functional, but it was also in the can in the corner.
Sure.
But nowadays the vein stays in the patient's leg, and we close it down with a nice little device that is relatively comfortable doing it. And then the flow, our body then automatically reroutes the blood.
Which is a good news, isn't it?
Which is a good
Were
thing.
you relieved about that, Noreen?
I
Hey,
was
wait a minute,
relieved
you take my
about
veins
that.
out, now what's going to happen?
My veins are rebels.
Yeah.
Yes, they've been in control now. They're rebels.
So we did that, and again, Noreen didn't have any varicose veins, so we didn't have to address that. But we did that, and we did some injection sclerotherapy of the bigger veins, not the superficial veins, but it brought about relatively good improvement.
Oh, significant improvement. I'm so happy about the improvement. I can't tell you.
One thing that you did say that your mother suffered similar,
Yes.
symptoms, right?
Yes.
Was there any, in her life, any plans of having it looked at or having it treated?
No, because you know what? I don't think she'd ever heard of the treatment. I only heard of the treatment here in Hawaii. And so, and my husband mentioned it to me years ago before I had it done.
Yeah.
And then he said, "Honey, I saw that guy again." I said, "What guy?" He said, "That vein guy."
Vein guy, yeah.
Yeah, the vein guy.
Yeah.
Get a bumper sticker, the vein guy.
But I think that maybe that a lot of people feel immediately, relieved to find out what it is. And then it'll talk about how you got ramped up and how Doc and his staff explained to you not only what you had, but what the treatment options were.
Well, I went, had the test done, went back, found out what it was. Do you want to do this? How will it help?
Mm-hmm.
That was my big thing. How will it help?
Sure, I'll do it, but what's the good side?
That's right. Because if it's not going to help me much, why do I want to do it? And he said, well, we feel, and this looks like this, we believe you can have great improvement. I said, fine, I'll do it. Because I needed the improvement. And you know what? I wish I would have known about this before I did, because I would have had it done then.
Everybody says that, including yours truly. Why didn't I get this done 20 years ago?
Right. We hear that commonly. And Noreen had another symptom, aside from the achiness, heaviness, pain, the discomfort that you were having at night. You had something called restless leg syndrome. And that's not an uncommon symptom of the patients that we have coming into the office. And restless leg syndrome is kind of it's a spectrum of things. I think most people understand restless leg syndrome to be spontaneous movement of your legs that actually wakes you up at night, and that can happen. That can really be obstructive to getting a good night's sleep, and it impacts your quality of life. But restless leg can be something as simple as just subconscious or unconsciously moving your legs around, because when people move their legs around, when you have that muscular activity, it helps vein flow. And so some people with restless leg, they can't even sit and watch TV for an hour. They have to get up periodically and walk around or stretch or whatever to relieve the discomfort and the symptoms that they're having in their legs.
Did you know you can have restless leg and not know it? It can wake you up multiple times a night, and you are not aware.
Did you find out that from your husband? He said, hey, guess what's happening to you in the middle of the night?
No, I found it out from a sleep study.
Oh, wow.
Yes.
Yeah, actually, that's an interesting point. You mentioned that before. You've been tested for sleep apnea, which they found you had.
Yes.
But at the same time, they were observing the restless leg as a reason for you to wake up periodically.
And it was off the chart.
You had sort of a double whammy there.
It's the story of my life, but I'm up for it.
I feel a kindred spirit because I did the same thing. I had sleep apnea years ago. I even had the CPAP machine in my home with the air. I don't anymore because it's been taken care of. But I think that maybe it's once again another part of the process of elimination. When you think, well, my legs are sore because I have sleep apnea. No, your legs are sore because you have vein issues and sleep apnea.
Yeah, right, sure.
So there's a deck of cards. And so from the time that you had the sleep test, did you have that? Did you have that machine and that air and all of that stuff?
Oh, yeah. I had it almost 10 years before I got my legs done.
Yeah. Do you have it anymore?
Yes, I do.
Okay.
Yeah.
So what when you did your sleep exam, what did they tell you? Did they say, well, half the time you're being woken up because of the sleep apnea, and the other half you're being woken up because of your legs, or what were they able to kind of separate that for you?
At first, it was you've got sleep apnea, and we think you might have restless legs. So as more and more tests go on, you've got both kinds of sleep apnea and really bad restless legs. Then when it went on, your restless legs are off the chart. They're off the wall. Yeah. How do you sleep? How do you do anything?
Were you tired during the day sometimes?
Exhausted.
Oh, boy, see?
Even with the CPAP, I was exhausted.
Okay, that's interesting. Very interesting.
Well, I think that when you start looking at all of these symptoms, Doc, once again, having a good primary care doctor or somebody is important because they all of a sudden realizes, this person has this, and this. We need to get the right hands on each condition and deal with them.
Right. Yeah. And and that's why for people like Noreen, it's more difficult for them to finally get to our office because so many of the symptoms are vague, and a lot of people don't really understand that they're connected with venous insufficiency, and even a lot of physicians, and I'm not being critical, but they just haven't been exposed to that information. But there's a lot of really kind of vague symptoms that can be disruptive to your quality of life that are due to venous insufficiency, and restless leg is one of them. But swelling, for instance, I think people who primarily have just swelling and achiness, which were, I think, probably your initial two most important symptoms, swelling and pain. And, just how that discomfort.
They both got your attention, don't they? The swelling and the pain.
Yes.
And both of them were disruptive with respect to your daily activities. It's most people are not going to immediately connect swelling and pain with, I have a vein problem. It's one of the reasons why we do this program, to try to get that word out there.
Another thing I notice is that I don't get cramps in my legs anymore driving. Sometimes I would get bad cramp in my leg. I'll be trying to rub my leg and drive. I'd have to pull over sometimes. I don't have that anymore.
Yeah, and cramping is another one of those symptoms. And cramping is another one of those symptoms that can be tremendously interfering with your quality of life, because we see this especially in older age group patients. I'm not talking about you, Noreen, but
he's talking about me.
Yeah. He's talking about me.
But especially the older demographic, they can be, they can suffer from night cramps so much that it really, it's as bad as sleep apnea as far as interrupting their sleep patterns, and they feel miserable. Cramping also is connected with venous insufficiency, and it's so rewarding for us when we see a patient like that. Of course, Noreen's in this category too, where you can really impact the way their legs feel and impact their quality of life and their ability to do the daily things that they want to
How
and
about
enjoy.
by getting up in the morning by saying, boy, did I have a good sleep this night?
Yeah.
Wow, what a concept. I slept.
Yeah, sure.
Well, I think what I think though is awfully interesting, and we talk about the interaction between specialists now, and that some things that you had can be indicative of other diseases or other things. Like you said, cramping, it can be venous insufficiency, it can be dehydration, it can be a lot of things.
Sure.
So you got to go through this checklist. Right?
Yeah, got to sort it out, and that's why I tell most people, hey, listen, if you're having just about any symptom in your leg, come on in and see us, and we'll help you sort it out. Now, it may not be due to poor vein function. It may be due to something else. But often when we're trying to figure out a problem, a medical problem of any type, it requires us eliminating diagnoses. We have to eliminate this and that, and then finally kind of hone in on what it really is. So, we can certainly tell people if they have a vascular origin for the symptoms they're having, whether it's vein or artery or whatever. But it's a good stepping stone.
Can I interject?
Sure.
I want to tell people that there's no shame in going and finding out that you don't have anything wrong.
It's
right.
relieving, isn't it? Yeah.
Think about that. Yeah, that would be a good thing to find out there's nothing wrong.
Yeah.
It would be a better thing if you find out that there's an issue, and you can get it taken care of and fixed.
Right.
That's what I was feeling, embarrassed that I really might not need anything done, and would I look silly?
Yeah. Well, and we hear that a lot, when people come into the office for, the initial consultation. I can't tell you how many times I've heard, I might be overreacting, but I just wanted to, look into this, and, maybe I don't need it. And people say that with a certain amount of shame, like you said.
Yeah.
But yeah, there shouldn't be that, because if you're having a symptom, and we've talked about this before. Often achiness and swelling, if it's not too bad, a lot of those things. A lot of people will chalk up just to age. They'll say, "Well, I was getting older."
I'm getting old. Yeah.
And,
Legs getting older.
and it was due to that. But usually, if there is a symptom that interferes with your daily activities, there's probably a reason, and often there's a reason that we can do something about.
Noreen, what were the things that actually transpired? Give me your office experience, because we tell everybody how thorough the staff is at getting somebody comfortable, and then I call it the dreaded iPad moment, because I felt a lot, but then I felt relieved that, boy, this sure gives this doctor an awful lot to go on.
Yes.
And it's going to get to the point. So let's talk about how you were told you had each condition, and then when did you start getting the treatment to handle those?
So I was able to get in a month earlier than I was planning on to have my procedures done, which is very good. And I went, talked about the iPad, all the information, filled it out, had the ultrasounds done, and went back to find out what they thought, and then set up the time to have my procedures done. Went in, had procedures done 5 days out of 6, and then went back for a follow-up. So I felt comfortable knowing that Dr. Juleff knew so many things that he had to know exactly how to treat me. Office staff, very professional, very thorough, and I felt as if I was in capable, confident hands, and I was.
I sort of expected that, and I knew it because that's the experience I've had. But I want to tell you that, one of the biggest deals now in medicine is that usually sometimes you don't really get to spend as much time with the doctor. How helpful is it to have all of that information that would have taken an hour to discuss when you can take a look at it and say, okay, based on this and seeing you, this is what we can recommend to get you on the right track.
Yeah, and that's why we do that. I mean, the electronic, we call that an electronic medical record,
right?
And it's all, everything's all computerized now, and it's sort of a double-edged sword. I mean, it does take more time, but it gives us so much more information, and probably more information than we would otherwise have gathered had we been sitting down in front of the patient asking all of those questions ourselves. Number one, and then number two, the electronic medical record has been good because it's very, very complete, and it's transmittable. If we need it in another office, we've got it there, or if we want to transmit it to another physician, we can do that easily. But the main benefit is that we have a lot of information that we have immediately in front of us when we sit down with the patient, so we don't have to waste a lot of time. We can spend the time that we do have with that patient talking specifically about their symptoms, how it affects them, what we have found with our workup, our diagnostic ultrasound, etc., and what we think we should do.
Another thing that I liked was how you measured my legs for the proper stockings that I needed, the support I was after. That was a big help. Everything is right there. It's so convenient and helpful.
Yeah.
Okay. Now, the reason I asked what I did, Noreen, is because I've had the same experience. But what you did is you had an intense bunch of sessions, right? 4 or 5 days in a row. Yeah. That's determined by how much work needs to be done. And why is it that? How do you break it up, and why do you break it up?
Well, partly because of positioning of the patient. We, some of the work that we do on the back of the leg. Mm-hmm. Some of the work we do on the front of the leg. So we try to kind of break things up according to the position that we need to have the patient in, because we work within a sterile field. Mm-hmm. So we clean the leg off real well, and the patient is in one position, and so we break it up a little bit because of that. We break it up a little bit because of just time. I mean, we want to keep it as comfortable for the patient as we possibly can, so we like to do things that take 30, 45 minutes, and it's I think in the long run much more comfortable for the patient. And also the amount of medication that we're giving. When we do the procedure, we're using a lot of numbing medication. So it's kind of, it's like going to the dentist, except that we're numbing up a bigger part of, your body other than just your jaw. So, but there's only so much of that medication that we can give any one person at any one time. So we kind of let that sort of direct us also.
Okay, because when we were talking off the air, Noreen, before we started taping, I asked, and I said, is it like having one pain replace another, but that the one that's gone now is going to go away because it's just temporary. Let's talk about that, your comfort level, and maybe just the blind faith that we need to take, the leap of blind faith to when we have finally let somebody do these things to us. Let's talk about as little by went by when some of the things that they said will happen did, like particularly in appearance in some places.
Well, they said you might have swelling, you might have a little bit of bleeding. I did, and I did. And nice compression, bandages with a support hose over helped
Are we
a lot.
talking, is that the Uniboot, Doc, that she went through like I did?
No, she did not need a
different kind of
Uniboot.
wrap?
Yeah,
Okay.
different wrap.
And so, I had pain and discomfort, but it was worth what I have now, and I would do it again.
Yeah. See, that-
And so also having one vein done at a time, I had 2 in one leg, 3 in another, and having that little bit done at a time was so much more comforting than, say, having it all done at once, even if you could. So I liked that, and it was spread out at a good time, and I'm just really, really thankful for
that's
it.
like we always talk about, Doc. It's walk in, walk out. I mean, it's so much less invasive than it was. I'd be sort of interested, and I'm sure the audience would as well, as to find out when you were starting to be able to do things again that you weren't really comfortable in doing, and is that still happening? Is your level of activity increasing, staying the same, or decreasing?
My level of activity has increased greatly.
Good.
And the level of activity from which I can enjoy things. For instance, I couldn't even stand up in church to sing anymore because my legs hurt that bad.
Boy.
And so I can do that now. I was telling Dr. Juliff before that even going to a big box store and pushing the cart, it hurt my legs too much to push the cart. I did that yesterday. So, I had swelling, and I think I probably had swelling a bit longer than some people might, but that is because of my own health issues. Definitely worth it, and that type of swelling is gone, and the swelling that used to get so great that my skin would have pockets of swelling on the side of my legs and hang down over my socks. Sometimes even hang down over my tennis shoes because I couldn't wear dress shoes anymore. It hurt too much. So everything has improved for me greatly, and I would recommend this to anyone. If you are wanting help, it is there. You just have to reach out for it. It can help.
I just see, if this were television, Noreen, we both see Doc just grinning, because that's obviously, not every outcome is the same. Sometimes, it takes a while, but it's sort of interesting. And I guess maybe, Doc, so that the listener understands, when they can get to a place mentally that Noreen was at, that all of a sudden now you're working in sync with the doctor. In other words, how much do you need from me, the patients, to know how I'm doing as you're proceeding with me?
Yeah.
Does that feel okay? Because that's what I get all the time, right?
Yeah. And it does take, the patient does have to be on board with what we're doing. I think you alluded to that, Noreen. Because, it's a stepwise fashion, and they have to be able to, so there's a little inconvenience in getting through the whole thing, but they have to understand that, there's a light at the end of the tunnel. And a lot of people will say, gee, my leg hurts a little bit more from a post-op standpoint. After the procedure, people will say, gee, my leg is still achy, or I have swelling still. And that's a byproduct of the procedure. I mean, all the procedures that we do,
And the bruising.
Yeah, I was waiting for it, and it was never going to go away. It did. It went away. Now I can't even see those spots where those things used to be.
Yeah,
Great.
And bruising is the exact same thing. I mean, it's an immediate post-op problem, and it will resolve with time. The same way that post-op discomfort and also the swelling will go away. But the reason that happens is because everything that we do, all the procedures that we do create inflammation inside the leg, and that's the way they work. We create inflammation inside a vein, and that's why the vein closes
I thought
down.
it was because I'm a swell kind of girl.
No, but
My husband looked at me, he said, honey. I said, you should see the other guy.
Yeah, that's right. It does look pretty gross for a while. And the interesting thing is, as it's healing, it looks even worse sometimes.
Yeah, sometimes it looks worse before it looks better. But eventually all of that goes away, and especially in people who were having some swelling before the procedure, sometimes they have even a little more swelling for the first 2 or 4 weeks, until again all that inflammation has to subside, and then it has created the beneficial effect that we want, and then it starts to resolve.
I don't know if you believe in magic or miracles. I believe in both, and I feel this has a touch of that. It's wonderful to get the help.
Yeah, and I think that the other side of it that's really nice is it's backed by science. You know, I mean, in our parents' age, they couldn't Google something.
Right.
They'd have to just take somebody's word for it. And now, isn't it sort of neat? You say, well, by golly, he said it was going to do this, and it did this. And now he said it was going to go that way, and it's going to go that way. I want to talk, when you said you had follow-up, what was that like when you first went back? And then the staff was telling you, hey, Noreen, this looks great. You know, this is wonderful.
I was elated. I also was glad to know that the swelling, bruising I had was normal for my situation because I'd had swelling before. And so as it went away, I have pictures. I could see it was getting less and less, and I was able to do more and more.
One thing, Doc, I think it'd be an interesting question that I would want to know too, and that is, obviously, Noreen as a patient had other medical issues that she was seeing other specialists for.
Sure.
But however, how does it work when, say, one of your patients goes to the other specialist and gets something done, so when they come to you, that part of what was bothering them isn't?
Right.
Do you know what I'm getting
Oh,
at?
yeah,
In
yeah.
other words, now when she goes to this guy or that guy, the sleep apnea guy might be, or gal, might be relieved to know, well, part of what was the problem was the vein issues they've been handled.
Yeah. I think that happens all the time, and it's nice when it does. And that's why we try to communicate with other physicians that may be involved with the care of any one patient, so that they know what we've done. It helps them direct their further therapy and helps them in their ongoing assessment. And I think the sleep problem in general is a perfect example of that. Hopefully the sleep lab people have now found a tremendous decrease in all of those symptoms that they were seeing before.
I think what I think that all the listeners also need to know this, and that is, it's not just a level of confidence, but I mean, obviously, a sleep apnea specialist might say, well, now that you've had that done, we can try this. We can be a little more aggressive in this or that area. Are you seeing others? I mean, right now you've gone through this treatment program with Vein Clinics. And by the way, if you just joined us, our patient's name is Noreen. She is a patient of Dr. Julef and Vein Clinics of Hawaii. You can go to veinclinicsofhawaii.com and see things like Noreen and what other people have. And I think it's the pebble in the pond, and that's what we try to do here. So it's kind of neat because I'm guaranteeing you, Noreen, for everybody that you would have said before was kind of embarrassing, that there's 1,000 people out there saying, I got what that lady has. I'm going to go see somebody.
There's help for it.
Yeah, no kidding.
Yeah, and again, I mean, that's why we do this, so that people can identify with things that are going on in their life, and hopefully it'll motivate them to come and see us.
And that being said, it's pretty convenient. But one of the things that when we said follow through and afterwards, just so that I know, so the listener knows, when were these procedures done? How long ago did you finish that one session where you had the several days in a row?
In August of this year.
In August of this year, 2019.
Yeah. Yep. So we're coming up on 6 months, and typically we do an ultrasound immedially after the procedure just to make sure everything looks good. And Noreen would have had that already, and it did look good. So then we periodically do what we call surveillance ultrasounds on an ongoing basis, because we like to keep track of how our patients are doing, and the reason for that is because venous insufficiency usually is a genetic thing, so it's not like we're changing your genes. It's not like we're fixing that part of it. We're just fixing whatever vein problem you have at the time. So might you have other issues come up in the future? Well, you might. Hopefully they'll be minor. And I think in my mind, if we do periodic surveillance ultrasounds, if you do develop something, we'll be catching it earlier than later.
Surveillance ultrasound. Sounds like
that.
spy
Sounds
school.
good. Yeah, me too. I like that. Yeah.
You're going to be on our surveillance list, Noreen.
That's right. Boom, boom.
But the other thing I think is important is the confidence level to go ahead and be aggressive on other things. For instance, since his follow-up. It's 6 months. It's like I said before when Doc and I were talking on another program, a dermatologist friend used to always say, get your birthday suit checked out on your birthday. And now, but as we get older, it should be more, probably a little bit more often than that. When you do that, Doc, just out of curiosity, because we've been through this before and we'll ask Noreen a little bit about it, a lot of what treatments you are able to accept are those that are affordable and those that are going to be, taken care of by your insurance. Are they happy about a follow-up procedure? Once you've had surgery that was approved by insurance, can you then get an ultrasound be part of the treatment?
Yes.
Yeah, that's good.
You mean with respect from an insurance standpoint?
Yeah.
The insurance companies allow for that because I think
you would think they'd want to know. Okay, since we'd spent all of this money helping this lady,
right?
How are we doing?
Right. Yeah. And I think, and that's another big part of it. I think when you look at the overall dollars spent in treating the disease, it's more economical to keep track of it on a yearly basis, let's say, and intervene earlier than later because you're going to be spending less healthcare dollars. Yeah.
Noreen, what about in your own case? Because obviously you'd had so many symptoms that bothered you to the point where you went to see the doctor. Was that explained, or did you anticipate, or was it ever a concern? How much does it cost to get all this stuff done?
Cost is always a concern for everyone about everything, even the food you eat, isn't it?
Yeah, a good point. Yeah.
And so, what is your health worth?
Yeah.
Is it worth taking out a loan if you need to?
Yeah.
If your insurance won't cover it, is it worth feeling so miserable? For me, it was not. I'd had enough misery, and life deals us enough. So, do what you can to help yourself.
Well, yeah. Well, I mean, those are all good points. Typically. Virtually all of the insurance companies cover this type of these types of procedures, and they all do it in a pretty comprehensive way. Most people's out of pocket is not too bad. So, and we try to, with respect to that, if people want to know what their out of pocket cost is going to be for getting procedures done, we're very upfront with that. We look into that for the patient and give them an estimate, et cetera. But luckily, as of now in this country, the insurance companies are covering this care, which they should. They have to. I can't imagine that it's ever going to stop.
Well, I mean, you talk quality of life, and Noreen, there's a lot of people that, you have these issues that you dealt with, and you must be a strong person because you dealt with these things for a long time. But there are some that their livelihood's affected. They can't stand up 8 hours a day like they used to in customer service. They got to sit down. So that being said, obviously you with you that wasn't a consideration. You once you had faith in the fact that I found a specialist that can help me deal with these problems, I'm just going to go do it.
Exactly. Yeah. I wanted the help. I needed the help. I got the help. And not only that, I felt that they wanted to help me. They weren't in it just for themselves. And they make everything as convenient and easy as possible for the patient. And I felt like I was in good hands.
Yeah, and I think that we've heard that a lot. As a matter of fact, I don't want to embarrass any of the staff, but all the staff that I've met everywhere are just so focused in on being a part of the program, a part of what's going on. So that must have been nice too, that when somebody's, changing the dressing or helping you do this or helping you do that, that they notice and let you know that they notice the progress that you're making.
And I want to tell people out there, one of the things that hindered me was the support stockings. I'd had surgeries before. I'd had to deal with those buggers. Yeah. They have this really neat device.
The roller thing?
Yeah, I love the roller thing. My new best friend. Yeah. It makes putting those stockings on easy. Yeah. There's help for everything nowadays, things to make things so much easier. It's just wonderful. And they sell it right there. You can buy it right there. Yeah. You don't have to go to the store. You don't have to go online. You can buy it right there.
You talk about being worth it. It's sort of interesting, Doc, isn't it? If you do it all the time, it becomes a routine. If you do it sporadically, it's an impossible chore.
Yeah.
It's just hard to get them on, hard to get them off sometimes.
Yeah, it is. And yeah, you're right. I mean, some people with venous disease and other related type things, they're going to benefit from using compression stockings long term, especially when swelling is part of the picture. And so you just have to get in the routine of wearing the stockings, when you can, and best done on a daily basis. And usually I tell people that if all they do is wear compression stockings on those days where they work, especially if they work in a situation where they're on their feet a lot, you're doing yourself a tremendous service.
Okay, I got a couple of questions that are related to that in a way, Noreen, and that is how confident you are, how comfortable you are now traveling. Because I do know that some people that don't wear the compression hose will wear it when they're going to travel because they know that's important. Have you been able to travel a little bit since you've had these procedures?
I haven't, not in a plane. No, haven't done that in a plane. But even in the car, my legs would swell badly.
Oh, wow.
Yeah, so I notice a big difference. And on some days when I feel like my legs might burn a little bit, I put them on. Because the roller thing makes it so easy.
It does, it really does.
Bada bing, bada boom.
Yeah.
So you have a roller thing at home.
Got a roller thing at home.
Okay.
What is it, the Doff and Donner?
Doff and Donner.
Yeah, love that thing.
Yeah, it's it saves us a lot of time day in and day out, that's for sure. But yeah, it makes putting the stocking on so much easier. It's been a good tool. I wish I would have invented it, but I didn't.
There's another little thing that I will tell you, and you can get these at Dr. Juliet's office as well. And these are they look like kitchen gloves, for washing dishes, but they're knobby. So when you put your stocking on, then you pull them up and it actually adheres to it.
Yep.
And if it weren't for that, I would have abandoned ship. And now it's just so much a part of my day. And then there's some of them.
Yeah.
And I don't know, Noreen, what kind you like, but I have some of the ones that have no toes. And I don't need the roller or the gloves for that one because it just goes on.
Right.
Isn't that part of it, that if you can get somebody over the hump, come on, just give this a try. If you do it for a week, you'll keep doing it.
Yeah. It is.
Yeah.
It is. I mean, I think a lot of people, when they think of compression stockings, especially of the type that we want people to wear, if they've had any experience at all in the past, they tend to shy away from them.
Yeah. And I get it. I really do.
Me too. They're tight. They can be hot. They're a little difficult to get on, but they're so worth your while.
And they don't have to be white anymore.
Yeah.
No.
You want the beige and the beige. That's what I see. Yeah. Right.
Well, the good thing is, there's a number of companies out there making good quality stockings, and they've got a lot of different styles. If you want sport socks, we've got them. If you want dress socks, we've got those. If you want the toeless, kind of beige, the routine kind of thing, we've got plenty of those. So I think we can try to keep just about everybody happy.
Yeah, and when but there is dangerous in some things, and that's self-diagnosing. I mean, I don't know how much time you spent, Noreen, on the internet looking around before you started making your move. Sounds to me like you saw something. You saw the TV ad or whatever it was, and say, you know what, this is it. I'm gonna go give this a shot.
Yeah.
But since then, have you talked to others? Have you been an emissary like you've been with us today?
Oh, yes.
Yeah.
I tell everyone.
Yeah.
Everyone I see. Why wouldn't I?
Yeah.
If you have something that helps that much, why wouldn't you want to share it with others?
How about standing up in church and singing now?
I do.
Yes.
Much to people's dismay.
Yeah. But Doc, I do know that there are some cases that are a lot more difficult to handle. There's some people that have either had the disease for so long or they're so debilitated that it really takes an aggressive, almost scary path of recovery.
Yeah. That's true. I mean, there's a huge spectrum of different types of vein disease that we run into, and in those more severe, long, like you say, long-standing. Especially if people were treated like years ago. We see a whole bunch of people that have had, vein stripping 20, 30 years ago, and they weren't followed. They didn't have their surveillance holders out, so we run into those people, and it can be challenging, but. The great thing about it is that the way we do things today is 99% of it can be done right in the office, and in a very minimally invasive fashion, and again keeping the patient as comfortable as we possibly can.
Okay, here's the other one, and that is at veinclinicsofhawaii.com. You can go and check it out. It's Big Island, Kauai, Maui, and here on Oahu, of course. And we talked about staff and support. Let's talk about home support. A lot of these things, Noreen, and it sounds like you had some really good, strong help from your husband, that a lot of people that need either help for this or understanding with this or just being comforted. Talk about, how that worked for you.
Well, the nice thing is, friends from church came over, visited me, brought me some food. My husband is wonderful. I am so blessed beyond measure. He's so helpful, so supportive, and even just to listen, I feel uncomfortable right now. So, it's a good thing. But you know what? If I hadn't have had any of that, it still would have been a good thing because the outcome. What you have to think about is the outcome.
Yeah, I mean, for instance, it may have been in the past too much of a chore to even think about going for a walk after dinner or doing something.
Oh, I could not. Yeah, not very long at all. Yeah.
So, I mean, I think it's not just, certainly not cosmetic or all pain related, but it is quality of life. How many more things that you feel comfortable of returning to that you didn't want to do for a while?
Yeah, I can mop the floor.
Yeah, wow, what a concept.
Don't you want to get fixed now? Mop your floor. I can walk my dog. I can cook.
Not only immediate quality of life, but also the other thing that you have to think about is that, if you have, fairly significant vein function problems, that it's a process that only gets worse with time. And, if you don't get it fixed now, then it's, a year from now, it's going to be even worse and maybe even more difficult to treat. But, so you're treating people to relieve the symptoms that they have right now, but you're also treating people so that the disease process doesn't progress and eventually end up into those higher levels of clinical severity.
Yeah, that's a good point, Noreen.
What do you do for your car? You need your car, right?
Oh, yeah.
You take care of your car.
Gotta take care of the car.
If your car has a problem,
if
your car has a problem, you got to fix it. Your body is your car. Your body is your vehicle. You need to take care of your vehicle to help it run better, last longer. And you know what? I'm not as cranky now. I'm not in as much pain, and I'm not as cranky.
Another reason your husband is happy.
And that holds true in a lot of things. I mean, you've heard of this, and I'm sure that you were told. You said that it really happened earlier. Sometimes when you're sleeping or you think everything's fine, your partner can't sleep because you got an issue or your legs are flopping around. You're
like an octopus.
Yeah, exactly. And that being said, all of these little victories add up. And I know, Doc, that sometimes it's a matter of having our listener just pull the trigger and go to veinclinicsofhawaii.com or call up. And obviously, not every result is going to be as picture perfect as Noreen's is, but it looks like if she hadn't have done something, that she just did, that addressing this a year or two down the road would have been a little bigger of a challenge for you.
Yeah, a little bigger deal, and also just putting her at risk for other things. For instance, venous insufficiency. People that have that have a little increased risk of DVT. We've talked about DVT a lot here, and DVT is something that could potentially be fatal. So, each year that goes by that you have vein issues that are not being treated, you're subjecting yourself to that risk. And also just subjecting yourself to a higher scale of disease that you don't want to have to put yourself through,
Yeah, and that's good. And so, before we say aloha for this version of this episode of the show, I want to make sure that Noreen is a real person, and I said earlier that we have an author in the midst. You're writing children's books. That must mean you have to have a pretty good attitude because you need to be happy when you write a children's book.
That's true. That's true.
When's the next one coming out?
I already have it in my head.
Oh, good.
Yeah, good for you.
Yeah,
cool.
We adopted a dog from the Hawaiian Humane Society, and it's about him.
Yeah.
Oh,
there you go.
Well, I want to thank you on behalf of all of our listeners and certainly Dr. Juleph's staff for joining us and continued success. I know you're not going to let a symptom go on for very long. If something pops up, I think you'll be right at it, right?
Right.
Okay, and Doc, we'll see you next time, and thank you very much, Noreen. And if you'd like to know more, it's pretty easy. You go to veinclinicsofhawaii.com, veinclinicsofhawaii.com. Couple locations, Big Island, Kauai, Maui, and here on Oahu. Get online and take a look at it. And look, every patient you see, but for the grace, can be you. And once you get yourself into a treatment program, you'll be so happy. So until next time, thanks for listening. We'll see you next. As long as you take care of those legs are going to take care of you.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.